Hello everyone, this is Dr. Kishore Gautam from Nepal. Today I will talk briefly about endocrine cancers. I will be talking about the different types of endocrine cancers, how to manage them and what are the presentation of these cancers. So beginning with the most common endocrine cancer, the thyroid cancer is the most common in clinical practice. So the most common presentation of thyroid cancer is the lump in the thyroid region. Whenever you have any lump in the thyroid region, you must be evaluated thoroughly in order to find out whether it is benign or malignant. The other presentation of thyroid cancer includes difficulty in breathing, difficulty in swallowing, and sometimes some patients may present with pain in the neck region, and whereas other patients may present with cervical lymphadenopathy. This is one of the cancer which has got best prognosis with minimal invasive surgery when it is diagnosed on time. So whenever there is any swelling in the neck, it must be evaluated. One important thing about thyroid cancer is not all the thyroid nodules are cancerous. Up to 95% of the thyroid nodule are benign or non-cancerous, and only 5% are cancers. Also, another important thing is that not all the patients require FNAC from the thyroid nodule. In general, thyroid nodule more than 1 centimeter require FNAC for further evaluation of the thyroid nodule. So whenever you have any lump in the neck, you must have to undergo ultrasonography of the neck in order to find out whether it has got any high risk features, and if it has got any risk features, then you should undergo fine needle aspiration cytology from the nodule, and it can be done either manually or ultrasound guided, but ultrasound guided FNAC is recommended. FNAC is a simple technique that requires insertion of the needle into the nodule, and some aspirate are examined under the microscopy and find out whether it is good or bad lesion. So there are certain criteria that requires urgent evaluation in thyroid nodules, like when the thyroid nodule is associated with hoarseness of voice, it denotes involvement of the recurrent laryngeal nerve by the tumor. Similarly, when the nodule is present in the childhood, then it must be evaluated urgently. Similarly, when you have your family members having thyroid cancer, especially the first degree relatives like your father, mother, and your siblings are having thyroid cancer, then any nodule in the thyroid region must be evaluated thoroughly. Similarly, when the thyroid nodule grows rapidly over a period of 2 weeks, then it must be evaluated urgently. Similarly, when the nodule is associated with any lymphadenopathy in the neck, especially the cervical lymphadenopathy, then it must be evaluated urgently. The treatment of choice for thyroid cancer or suspected thyroid cancer is always thyroidectomy. So this involves total thyroidectomy, that is the removal of all the thyroid gland, and after thyroidectomy you may develop some complications, immediate complications like hypocalcemia. Whenever you have tingling sensation of the leg or cramping of the legs, then you must have to undergo serum calcium monitoring or serum PTS monitoring to find out whether you have hypocalcemia or not. And whenever you have these symptoms, you must have to notify your treating doctor or nursing staffs. Similarly, after the operation, you must have to undergo some blood tests like serum thyroglobulin or serum calcitonin, depending upon the type of cancer, to find out whether there is any recurrence of the disease. Similarly, you must have to do thyroid function test as well as ultrasonography of the neck to find out whether your thyroid function is within normal limit, and also to find out whether there is any recurrence of the thyroid cancer. The next tumor I am going to talk about is one of the rare endocrine tumor, that is the neuroendocrine tumor, also known as NETs. The presentation of this tumor is usually late, because when at the time of presentation most of the tumor are already metastasized to liver. So it is very important to know the sign and symptoms of this tumor, especially whenever you have flushing of the face and loose motion, you must have to undergo thorough investigation to find out this kind of tumor. This kind of tumor arises anywhere in the body wherever these neuroendocrine cells are present, especially in the pancreas, in the lungs, and in the small intestine. The treatment of choice for this kind of tumor is always surgical removal of a tumor, even if there is liver metastasis, and for symptom control, some medications like somatostatin analogs can be given. Thank you for watching this video.